Good evening, everyone. My name is Joan Jones, and for my paper and presentation, I chose to further research Afaf Ibrahim Melis and her transitions theory. This theory really appealed to me because of how thorough and how comprehensive it was, and it was relatable to me on a personal level. How adaptable it is to many patient care situations, various specialties, and clinical scenarios. So, a little bit about Dr. Melis. She was born in Alexandria, Egypt, in 1942. Her biggest inspiration was her mother, who, according to Alligood, was considered the Florence Nightingale of Egypt. Her mother was the first nurse to earn advanced degrees from an Egyptian university, and so naturally, Dr. Melis followed in her mother's footsteps and earned her nursing degrees as well. Her work includes contributions in nursing leadership, administration and education, and overall just advancing the nursing science and discipline. Many of her accolades include awards as an activist on women's issues, their health and development, promoting leadership, diversity, and healthcare in the global community setting and various community settings. She's published many works, one of them including her award-winning book, Theoretical Nursing, Development and Progress. From the 60s to 80s, she spent a great deal on the concepts of role theories, role supplementation, and the importance of transitioning from one role to another deemed as healthy or unhealthy, especially as she studied parents, notably women, in their new parental roles, post-MI patients, older adults and their caregivers transitioning into different roles in their lives. Eventually, a framework was conceptualized when she discovered that the concept of transitions needed to be researched more. And then later, it was utilized as middle range theory and published in 2000. So these are the major assumptions of her transitions theory in relation to nursing, person, health, and environment. Nurses care for all patients in various stages of life and in all stages of transition. Therefore, nurses play a pivotal role in aiding patients with transitions, especially assessing them and educating them on all necessary components to ensure they make healthy transitions. Transition is fundamental in the lifespan of all individuals. Individuals go through developmental stages of life. It's a universal component of life, and that is transition in itself. And so Melis considers this in her theory. As nurses caring for individuals undergoing transitions, it's important to recognize that the patient's experiences and perspectives influence the transition. And as a result, transitions shape the undergoing changes, whether that be in the patient's role, their identity, behaviors, emotions, etc. Transitions are complex and multidimensional. Situations of wellness and illness are affected by the individual's changes over periods of time. Transitions are layered and complex, and they're influenced by so many components of an individual's experiences and how they perceive these changes or differences in their lives. Vulnerable states can result in unhealthy transitions. We have to understand that as an individual transitions, they feel vulnerable and may be placed in a state of vulnerability, which can result in unhealthy transitions or negative coping mechanisms. A negative or less than favorable environment can also influence the transition. As nurses, we have to recognize and understand these components as they should be considered in their overall care. So one of the major concepts of the transitions theory are the types and patterns of transitions. There's 4 types. It's the developmental, health and illness, situational, and organizational. Developmental includes all of the developmental stages of an individual's lifespan. So that's birth, adolescence, their adulthood, menopause, if it's applicable. Health and illness, these are specific transitions that relate to a patient's status in terms of their health or if they get ill. An example of this would be them obtaining a new medical diagnosis. Situational, this can overlap with health and illness, but these roles might be changes to an individual's home, such as moving into a nursing home or a rehab facility post-discharge from the hospital. Organizational, this relates to changes in structures that surround the individual or just their environmental conditions as it influences their life. Another major concept of the theory is the properties of transition experiences. This is the awareness and engagement. Patients may or may not be aware that they're undergoing transitions, and it can influence their engagement or their involvement and the roles that they decide to undertake in these times of change. Change and difference. Are there changes involved in these transitions, and how are they different from their previous experiences, prior to the transition? Time span. Transitions occur over a period of time, so there needs to be an onset, that period in the middle of instability, and then a discernible end. Critical points and events. These ends can be critical points which relates to the patient's overall success of the transition, or it can signify a significant end, as in death. Other major concepts include transition conditions. So these could be facilitators or inhibitors. So they shape a person, they shape the way a person navigates the transition, and it includes their personal experiences, their preferences, their culture, their beliefs, educational status, knowledge, their environmental conditions, and access to resources. These factors can either facilitate a positive response to the situation or inhibit them from successfully coping with it. Patterns of response include process indicators and outcome indicators. These are just used to help nurses identify if an individual is successfully coping or managing a transition, and they're categorized for the most part as healthy responses. Process indicators can be verbalizations by individuals in relation to feeling connected, interacting appropriately, or stating confidence in their role. Outcome indicators are mastery and fluid integrative identity. So these can be identified as behaviors interpreted by the nurse as the patient successfully moves into their transitional role. And then finally, nursing therapeutics. This provides the basis for nursing interventions in the clinical setting. So the nurse must initially assess readiness of the individual's role and what their involvement is in this period. And that includes assessing their understanding, their emotions, expectations. After the assessment, the nurse prepares the individual through education, and then role supplementation helps the individuals and their family members or any involving parties in their lives to clarify the roles that they are undertaking. The next slide is just a diagram of the all the concepts that I just spoke about as they relate to each other. So the case study that I chose was conducted by Mia Beramani et al., and it was conducted in Sweden between the years 2013 to 2014. The format was done in an interview style, so they were asked a series of questions pertaining to the patient's experiences in various stages of their transition into parenthood. So this included their parents' experiences of transitioning to parenthood, parent education groups, professional support, continuity after childbirth. 60 parents were interviewed, 38 women, 22 men, aged 20 to 46. 49 parents were first-time parents, and 11 had at least one other child. So this scenario was a developmental type of transition, as is a common occurrence to transition into parenthood in one's lifespan. What were the facilitators and inhibitors? So the responses yielded positive perspectives that identified the patient's awareness of the situation, also taking into consideration their experiences for those who were not first-time parents or those who were first-time parents. Most of them were proactively seeking advice and education about parenthood from their family members, using the internet as a resource. They were preparing for the transition by purchasing equipment, and getting their locations situated. They were engaged. Parents also sought the help of relatives, so they were interacting appropriately, or they were interacting with friends who may have had the same experiences, who also provided insight to resources or groups. On the other hand, there were some inhibitors. Some patients or some parents experienced negative transition responses, such as having unrealistic expectations when they realized that parenting was difficult, and it caused a lot of emotional stress, anxiety, loss of control. They were unsure about their responsibilities. Some parents complained about negative experiences with breastfeeding. Um, and this was expressed by, negative feedback from healthcare professionals and the public and their own expectations of breastfeeding demands. There also wasn't enough professional support and education provided. So whether it was from not having therapeutic relationships or a good rapport with their providers, or being unable to access maternity care, or just having overall anxiety about opening up about their experiences as parents. Process indicators and outcome indicators. So again, I just talked about their awareness, their engagement, interaction, confidence, and their mastery, how they felt after they mastered that role of parenting. So they verbalized feelings of connection, proper interaction with family, friends, groups, feeling confident in their role as parents. And then our role as nurses, to provide support, education, and continually assess these patients in all stages of the transition. So in terms of this case study, assessing the parents' readiness and their involvement in this transition, their behaviors and emotions regarding the changes that they may have to undergo or the roles that they may have to undertake. During the transition, assessing them for various negative outcomes such as anxiety, stress, offering them groups or resources to guide them to more facilitative outcomes, educating them on the pros and cons of, parenthood, having them kind of verify what their expectations are and clarifying that with them. And then afterwards, to assess their mastery of their role as parents. Again, this theory can be utilized in many scenarios. Transitioning into parenthood is just one situation based scenario, and it's something that I can relate to. And that's why I chose this scenario. But this theoretical framework has been used in many other clinical situations. I hope you found my presentation informative. Thank you all so much for listening. Hope you enjoyed.